And then from here, I can speak about the post-transplant management. And the post-transplant and rejection and infection malignancy, the balance will be the most important. And then patient after transplantation, the patient have to come to hospital forever, and then they need requirement of the microbiopsy to check rejection and coronary angiogram. So they have to come very frequently to hospital to manage their heart. And then reason for death after heart transplantation is described here. And then patients may develop transplant coronary vasculopathy, and the patient may develop the PTLD, post-transplant lymphoproliferative disorder, a type of the lymphocyte malignancy, and also renal failure can be fatal. So this means about 10 years post-transplantation, patient may develop several complications and patient may die. So transplant is not a permanent cure. That is another message I want to provide today. And then 10 years after transplantation means the patient, these are the pictures of my kids sitting there, and then they may transplant at this age. They develop like employing this, and then after 10 years, the recipient may die. So that is sometimes very tragic. So we have to take care of them very carefully. Okay, so for this long-term outcome after transplantation, well, I would say the mean survival years are getting better. The result is getting better. So now how will the patients survive over 10 years? So I want to show several cases. The case one is patient on the out of 20 years post-transplantation, and patient transplanted at the year of 10, and she was great, and then she didn't have any grade 1A means rejection, and she was very well until the 34 years, and then she even gave a birth. And then now she is about this year, also 20 years post-transplant, she is doing great. This is the first case. And the second case is a patient who died at the 11 years post-transplantation. This is the patient, the 34 years of the transplanted, and he was actually the physician, my colleague. And then, so no rejection of initially, but developed the diabetes, and also transplant coronary vasculopathy, and the renal dysfunction, the myelosuppression, and then also this patient even developed chickenpox, and then the herpes zoster, and then renal dysfunction, and then this progressed, and then she eventually died at the 11 years post-transplantation. And so this is the average cases. And then actually these complications is due to some the immunosuppression, some the drug-induced complications. And then another case is this is 34 years post-transplant. So 34 years is very significant. And then patient get heart transplanted at the age of 17 and return to school, work as a teacher, and then there's no complication of until 30 years post-transplant, and first developed the kidney dysfunction, renal dysfunction, and then eventually, so the renal dysfunction deteriorated, and he is now on dialysis, and the transplant coronary is getting very narrow, and then so this is the international center who had a lung transplant survival curve, and he is around this area. So 34 years post-transplant, his prognosis is very poor. So he may require retransplantation, but not possible in Japan. So I will talk about this case later. So we learn a lot from these cases. So what we should do to stay patient in a good shape for longer, and then how to the early detection and intervention for the patient, and also for this patient, the prognosis for the third case and the 34 years post-transplant, but retransplantation is not possible. So I would say life expectancy of transplant risk patients is not equal to general life expectancy. So what we should do?